I'm back. We're going to go ahead and do blood pressure assessment for the second portion of the lab practical. So go ahead, move over a little bit. All right, cool. So what you want to do is you want to make sure that the patient or client's arm is supinated and relaxed. You want to also have it straight but not locked. Obviously we don't want it locked. And what you're going to do is you're going to go ahead and palpate for the brachial artery. That's what you're going to be using to assess blood pressure. So it is on the medial side of the arm, and it is proximal to the elbow and deep to the biceps brachii a lot of the time. So you have to just assess, see if you can find it. All right, there we go. And what you're going to want to do is, I don't have a blood pressure cuff or a stethoscope, so we're just going to use our imagination here. You're going to slide the blood pressure cuff on him or on your patient, and a lot of the times there is a marking for their brachial artery, so you want to make sure that is aligned with the artery over here. And then you're going to, after that is on, you're going to go ahead and place your stethoscope over here, and let's say I have the pump in my hand. You're going to make sure it's closed, and you're going to go ahead and pump it up all the way to between 160 and 180. Then after you have it there, you're going to go ahead and make sure you're listening, and you're going to go ahead and allow pressure to release from the cuff, about 2 to 3 millimeters of mercury at a time. You're going to allow it to release, and you're going to be listening for the first Kurtikoff sound, and that one is going to tell you systolic blood pressure. Another tool that you can use is on the dial. Sometimes it'll start ticking. A lot of times it starts ticking. As soon as you see the tick, you should know that the sound must have already happened. And then you're going to go ahead and keep releasing after you've heard the first sound. You're going to keep listening, and you're going to listen for the last or second Kurtikoff sound, and that's going to tell you diastolic blood pressure. Okay, after you know both of those, you want to make sure that it's within the normal range. Normal range is going to be below or at 120, and then below or at 80 millimeters of mercury for diastolic blood pressure. If the systolic blood pressure is above 120 or diastolic blood pressure is above 80, then you know that they are either pre-hypertensive or within the 3 stages of hypertension. Cool.